Are you a friend or a family member in orthopedic limbo? If you have joint pain that keeps you from pursuing the activities you love, but you're not a candidate for joint replacement surgery, that's orthopedic limbo. You'd like to return to the exercise routine. Perhaps this is pickleball, jogging, or taking a walk with friends. But every time you do so, the familiar ache in your knee or your hip holds you back. So what can you do? Hello, my name is Dr. Tom Buckheit. I wrote the book Healing Joints and Nerves to provide answers and options. Let's first talk about traditional options for arthritis pain. You could try steroid injection. Corticosteroid injections work reliably, but unfortunately they don't always last. Many individuals then find themselves receiving repeated steroids. Is this okay to do? Well, the medical community used to think so. However, in 2017, a research study was published that was a wake-up call for all of us. It was a study that compared steroid injections to placebo for individuals with knee arthritis. There was no significant difference in pain in 2 years. The concerning part of the study was that the effect of steroids in cartilage health. The steroids actually worsened their arthritis. Perhaps you've tried a gel injection or something else into your knee or other joints. These procedures, which inject a substance called hyaluronic acid, are also commonly performed for knee arthritis and other joints. Adding this lubricant will sometimes work longer than a steroid injection, but oftentimes the pain relief isn't significant. These limited improvements have led the American Academy of Orthopedic Surgeons and American College of Rheumatology to recommend against the use of hyaluronic acid injections or gel injections for arthritis. Arthroscopic surgery is performed over 1 million times a year for joint pain. It has become a much less common procedure for arthritis, however, and things like degenerative meniscus tears because of several studies that show it's no better than sham surgery. To improve joints longer term, we need to look at therapies that stimulate immune cells and the healing response. These are the regenerative therapies, such as platelet-rich plasma or autologous conditioned serum. That's part of the Regenikine program. I've discussed in a previous blog the importance of platelet dose for effectiveness. These procedures only work when there's sufficient energy to jumpstart the healing cascade. In addition to seeking options for longer-term pain relief, there's also growing evidence that regenerative therapies may help preserve cartilage and joint health in the long term. So don't let frustration set in. Before you dial back on your exercise, find out if you're a candidate for one of these therapies that I discuss in the book. Our bodies are built to heal. We just need to activate those repair mechanisms. If exercise and nutrition aren't enough, regenerative therapies such as platelet-rich plasma or the Regenikine program may be an option for you. Thank you.